I'd like to call the special called meeting of the Board of Education for the Public Schools of Robeson County to order. This time, and I'd like to note that our attorney, Mr. Grady Hunt, is listening via the internet, and also board member, Mr. Dwayne Smith, is also listening in. Mr. Terry, if you would, please give us our invocation.
Father God, thank you for this day. Lord, I pray that you guide us always in this meeting, Lord. Lord, I ask that you strengthen us to make the decisions that need to be made, Lord. And I pray that we'll be like a well-watered garden, like a spring whose waters never fail. I pray that we will be fruitful. Please guide us, Father God, in this meeting so we can be productive and let us make the decisions that need to be made. Thank you. Thank you so much for this day once again. Lord, we ask for your guidance, leadership as we conduct this meeting. In Christ Jesus' name we pray. Amen.
Amen. You see the agenda items, that we have a motion to adopt the agenda?
So moved. Second.
A motion and a second. All those in favor, please say aye.
Aye.
Any opposed? Okay, the agenda has been adopted, and the agenda item for tonight is about a school reentry plan. And so at this time, Mr. Freese, we will turn it over to you for information.
Chairman, we have been tweaking the public schools of Robeson County's reentry plan, and we understand that to open schools safely, it is crucial that we take the necessary measures to limit the spread of COVID-19. The policies and procedures that we are working on are fluid and flexible. We're taking a multi-pronged, layered approach to protect our students, educators, and staff. Our strategies can be revised and adapted depending upon the level of viral transmission and test positivity rates in our community as well as the schools. We continue to be in close contact with our local public health officials, state and other medical experts. Our strategies are intended to mitigate, not eliminate the risk. There are no procedures that will eliminate the risk of COVID-19. However, the implementation of coordinated interventions can dramatically reduce that risk. There are several members of our committee who will share some of our interventions and options that will address reentry. According to the governor's mandate, we are in Plan C, which is virtual. Tonight, we're going to talk about models that we have been working on. We have met with the principals and we have received their input, and we will share, if you would like, a recommendation tonight. Mr. Robert, I'm going to turn it over to you.
Chairman Lowry, Superintendent DeFreeze, board members, yes, thank you for being here tonight. As Mr. Freese said, we have been meeting over the last few weeks on our PSRC reentry plan. Today, we had the pleasure of meeting with 34 of our 36 principals, and we were able to garner their valuable input. So tonight, I would like to share with you the two options that the committee and the principals have developed that we would like to share with you tonight. Option A, and if you want, the PowerPoint is in front of you there at your table. Option A. Option A is an A-B week. Okay, so we'll have a cohort for week A and a cohort for week B. Cohort A will attend during their weekly schedule, Monday through Thursday, and will provide remote learning during Friday session.
Excuse me, Mr. Chair, did you give us a hard copy of that?
Patty, will you make sure they all have?
Got it. Sorry, go ahead.
All right, I can start over. All right, so option A is our A/B week model. There are two cohorts, week A and week B. I'm sorry, cohort A, cohort B. Cohort A will attend week A, Monday through Thursday, remote learning during week B. Cohort B will attend week B, Monday through Thursday, remote learning during week A. And Friday is remote learning for all as currently with our asynchronous day. If you flip to the next page, it's just a summation of that same option. And then the committee and the principals came up with pros and cons. And I'd like to share those with you at this time. Advantages of option A, all students get to be on site for some days with teachers and other educational staff. Facilitates direct instruction with opportunities for application of learning. Teachers are able to effectively plan a week's instruction without interruption. Students can get accustomed to procedures of the classroom more adequately. This reduces student density by 50% on campus and on buses. And then the last advantage is bus routes can be coordinated more effectively. And you'll hear from Dr. Guzman in just a few minutes as he talks about the bus routes. The disadvantages, positive cases may interrupt school schedules. Teachers will have to teach students who are in class and remote simultaneously. Childcare issues for off-site days, and we have to consider the special considerations as they relate to families with multiple students across grade levels, and staffing allotments for off-site remote learning, where they were serving as facilitators. And that is option A, advantages and disadvantages. The next page is option B. Option B is 1 week face-to-face and 2 weeks remote learning. All pre-K3 students will attend school for 1 week, then remote learning for the next 2 weeks. Week 1, face-to-face, week 2, remote learning for all, week 3, remote learning for all, and week 4, face-to-face. Option B, pros and cons. If a student tests positive or is exposed to COVID-19, then the students within that group can be quarantined for the necessary amount of time. That's the advantage of option B. The disadvantages, space will be limited. Social distancing will be difficult. It will be inconsistent routines, may lead to teachers spending more time reestablishing routines, teaching content. Childcare, of course, will be an issue. And assignments done in class may not be able to expand outside the classroom, considering at-home resources. So those are the two options for the board's consideration, option A, option B. And at this time, we'll have a presentation on nutrition, followed by transportation, health services, school reentry plan, Mr. Bobby Locklear, and Ms. Thompson will close it out with human resources.
Good afternoon, Chairman Lowry and board members and Superintendent DeFreeze. Child Nutrition is ready and willing to provide our students with nutritious meals while we face the crisis together. Child Nutrition continues to serve children of our community from the ages of 1 to 18. In October, we served about 828,000 meals. At this time, Child Nutrition is still operating in a positive side, around 2 million in the month of October as revenue. The Thanksgiving and Christmas holidays are approaching, and Child Nutrition will be providing breakfast and lunch for the kids during this break. In the reentry plan, breakfast is going to be a grab-and-go stations for in the mornings. It is a shelf-stable meal that the children will receive. Lunch will be picked up in the cafeteria. It'll be a grab-and-go too, put it in a bag, and the children will return to the classroom to consume. Water, we will provide in a souffle cup with a lid so that the children have access. If that is still the option, water fountains not being used. Some groups will be allowed to eat in the cafeteria based on the needs for the schools, depending on pre-K and kindergarten, that we may set up the cafeteria. Be able to accommodate their smaller children. Remote learning will continue to receive meals delivered through our middle schools and our high schools with the bus deliveries. Do anyone have any questions? Yes, sir.
Folks, let me say this. If you have questions for Ms. Charlene, let's try to look at this, take a moment and ask her now. And Dr. Robert will, if someone has questions for you, we'll bring you back up and try to get those answered now and then go on through the rest. So if you have any child nutrition questions, let's try to ask Ms. Charlene now, if anyone has any.
Thank you.
Dr. Guzman, before you come, does anyone have any questions for Dr. Robert when he was up?
Well, the only question I have is we presented two options that I want to know, and just looking on the surface, looks like there was more cons with that second option, but I won't, Stain or Dr. Robert, somebody, I assume my intake would be going with option one. Is that what y'all recommend or prefer?
Hey,
Hey, yeah, okay. That's what I want, that's what I thought. I just want to hear somebody say it. Okay.
Dr. Emmanuel?
Mr. Craig, Mr. Robert made a comment in which it's right. I'm not questioning the legitimacy of it. But you said that if a child got COVID, the one in the class, it would have to all be quarantined in one of the options. But that would be true in both options. If the children came on a rotating schedule, whoever came that day, wouldn't they have to be quarantined as well?
Yes, it's our presentation.
Okay.
Yes, ma'am. You're correct.
and two, the option that he was talking about in option B, if you're on a week, face-to-face a week, and then you're out 2 weeks, the thinking of the group was if someone has COVID, then they have that 14-day period
Okay.
for exposure and COVID.
Yes.
Yeah, but that could, but if you do that scenario, and I don't think we are, still, you could get into 4 or 5 days before somebody's exposed. So that just throws that all out, you know what I'm saying? Because if you have 14 days and you get sick the 5th day, so to speak, then,
Then you're gonna move on.
yeah,
That's true.
yeah.
And
Dr.
we're
Robert?
thinking that when the kids are there
There.
for that week, if anybody has it or is exposed, that group of children will have 14 days out to be ready for the next week.
Yeah, that's fine.
Dr. Robert, on option B, week one is face-to-face. Now, is that week one saying that all the kids in that classroom will be there?
No, sir.
So week one is face-to-face for 50%.
So now-
Okay, then that group that's there then, they will be home for 2 weeks.
Yes,
And there'll be another group coming in the second week for face-to-face.
yes, sir.
Then they'll be home for 2 weeks. Is that right?
Wait a minute, Mr. Gray, say that one more time. I'm sorry.
That's the reason I'm asking this.
Yeah, say that one more time.
Let's go back to week one, okay? And we're doing pre-K 3.
Okay,
We're week one and we got face-to-face. Whoever's coming, after they're there that week, they're gonna be home for 2 weeks.
no, you're talking about option A.
No,
No, I'm in option B.
Okay.
I'm on option B. There you
I
go.
understand, okay.
Yeah,
Option B.
this year's got that week one on option B, there'll be a group there face-to-face. And what I'm asking is that all the students in that pre-K 3 would be there then?
Yes, in option B, yes, sir. In option B, all students that the parents opt for them to go back face to face.
Would be there,
Yes, sir.
okay?
And Mr. Craig, if I could just.
Go ahead.
check, when we done the survey, back in October, it was like 52-48,
Mm-hmm.
with the parents agreeing to do face to face. So we're planning the model based on 50% capacity.
Okay,
Yes, sir.
and my follow-up to that then was going to be, which you kind of answered it, if we're bringing them all we do have sufficient classroom size that they would still, and I think there are some things that they don't have to be spread out, but we still could spread the students out in the classroom. Okay, and then I go back to, on option A, let me see if I can find where I had one there. Okay, again, the first group attends on the first week, and that second group is at home, that Monday through Thursday. Okay,
Yeah,
then,
okay.
and then they're just gonna flip,
Yes, sir.
and then Friday's gonna be remote for everybody,
Asynchronous for both
for
groups.
everybody. Okay, all right, I think Mr. Vontae and then Mr. Brewer.
Will each parent still have the option to just keep their kid home virtual?
Yes, yes.
Have that option, all right.
Parents
matter what-
have the option of face-to-face or virtual.
No matter which model we pick.
Right.
Okay, I just want to make sure.
That was my
Clarify that.
question.
And anybody else? I have one more.
I just,
Manny?
I want to understand what you said. There are other questions, but you have someone that address the cleaning and all, somebody else here is going to go into those
And I did
areas.
forget our expert, Mr. Jimmy Mercer, and I apologize, Mr. Mercer. He is here to talk about our cleanliness,
All right.
sanitation.
Okay, then a question for Mr. Robert. You said a con and you were going to address that. Parents, when they have like kids in the second grade, kids in the seventh, kids in the eighth, that you could address it. How will you address that if you're just doing K-3? I guess I'm confused with that one. You had a con about one of the models,
Yes,
and you said if a parent had a child in multiple grade levels, you would address that. How will you address it?
right. And we talked about that today.
Yes, sir.
Because if we go with pre-K 3 and say if a parent has a third grader and a seventh grader,
Yes, sir.
there is going to be some issues with the childcare. So that is definitely a disadvantage.
But I thought you said we would address it. That means what?
So I mean, I read the con under option B.
That'd be a con under anything, wouldn't it?
Yeah.
Yeah.
Any problem, anything you do.
That's what I said. Yeah, we put that on B. Yeah, childcare for A, B, and for, option B, option A and option B.
But I think, he answered it down there when he said parents had an option not to even get involved. They could keep them at home, so I think
Right,
you.
yeah, they still have the option of virtual. Yes, ma'am.
And now another question. Are we just talking about pre-K through third grade or we talking about the whole school system?
Pre-K through third grade.
Okay, I just wanted
Just for the.
that clarification.
Yeah, just for the initial reentry.
Yes, I want to make that clarification.
That would be pre-K 3 plus or pre-K 3 self-contained exceptional children.
How do we come about, oh, I'm sorry.
Let me get Mr. John, then I'll get you, Mr. Henry. Mr. John?
If the parents decided to keep the kids home, what would their schedule be? Would it still be like it is now, or
Yes,
would
it would be the same schedule we're running now. Yes, sir. The virtual learning process will continue. Yes, sir.
Mr. Henry?
How do we come about determining pre-K to grade level 3? Is there a reasoning behind that?
Well, I think Dr. Guzman is going to talk about that in his transportation because we didn't want to start with too many students, with the buses. And I don't want to take away his presentation. But we got to look at the numbers that we can put on the bus.
The data, don't.
And then we just felt like with pre-K, it would give us the opportunity to manage a small group before we decide to go with middle and into the high school.
Oh, and, Sir,
Mr. Lowry.
Frazier, addressing pre-K 3, those are the crucial years of a child's education. Because by the time they reach third grade, if they can't read, they're in trouble for the entire educational process. So that's a major reason to get those students in school, the reading and the math. A lot of school districts are just using math and reading in order to catch them up. We can work with grades 4 through 12. But this is the most crucial period in a child's life.
Okay.
And see, our pre-K kindergarten students have not even been in a school setting, so here is almost November, well, it is November, soon to be December, and so they definitely need to get back. Or get-
Mr. Lowry.
Let me get Mr. Dwayne.
Yes, sir. So right now, the two options that we have, A and B, we're just concentrated on K through 3, nothing 4 through 12. Is that correct?
Yes, sir. I think it's actually got a pre-K through third grade. Yes, sir, that's right.
For January, or the first of the year, in other words.
Yes, that's correct.
Okay. All right.
Dr. Emmanuel?
I'd like, and you may say, wait, till she gets up here, but Mr. Freeze hit the nail on the head, but there's another reason too. If you check the data, those children under 10 years old, according to what data I've read and data presented on news, they don't contract the COVID. They don't have the data to show that they've contracted the COVID as much as older children. So when she gets up, she might need to address that. So those are two reasons, what Mr. Freeze said and the data that shows that, if it's indeed holding.
Dr. Robert, let me have you address, because this had been a concern of mine on the cons, and it's actually on the, which I think it'd be doing it on either one, but I see it here on option A/B model. We will have teachers teaching remotely and teaching to their students in the room.
Yes, sir.
So now, the teachers in the room teaching now, which is what they're doing now remotely. So now, if I'm the teacher and I'm gonna be doing both, I'm gonna be in that classroom, I know we were working on ordering, I guess, those swivel cameras. So the swivels will be there in place, so that one teacher would work during the day, and they would have kids, like, we got schools with only one fourth grade math teacher. We're talking about pre-K 3, but we got schools with only one teacher in that area. So is that why we're looking at the teacher would be teaching to both of those from that standpoint? Some schools might have two, or is it just easier to say they'll be doing them both, that one teacher's got everybody?
I know, excuse me, but pre-K 3, they're all self-contained.
Right.
Yes, sir, we don't have any that block.
Okay, but do we have any schools in this category that, let's say they've only got, well, they would have more than one teacher, so there's no blocking, so you're right, that takes care of that. So if we go further along later with other grades, we're gonna have to
Into fourth grade, they start blocking.
blocking.
And then, yes, sir.
We're gonna have to look at some maybe other options there at that point.
She'll hit that when she talks about the HR.
Okay.
Getting additional personnel with the substitutes. We have teachers that are out.
Okay, all right, thank you. Mr. Brewer?
How will we work in, our EC? Would that be conclusion or?
For the EC, pre-K 3 will be self-contained. So they'll be in their separate classroom, yes, sir. Yeah, because all those classes, Ms. Brewer, are self-contained, the ones that we're bringing.
Anything else for Dr. Robert?
Hurry up and sit down, Robert.
Okay, who's next? Dr. Guzman.
Good evening, Chairman Lowry, Superintendent DeFreeze, board members. Mine, I'm sure I'll go over briefly what the bullet points are, but I'm sure I'll probably have more questions than anybody else because our goal is to get the students there as safely as possible. First and foremost, our key is going to be is we're going to need to know exactly who rides, because no matter how we have tried to divide up the K3, whether it be alphabet, whether it is to designate via giving to the principals an availability to find out which is how they want to group them based on their, they can maximize their teachers. It creates disparaging numbers no matter what. For example, one school, at one point, if we went A, no matter what, was 53 by a designation of alphabet, and 129 was B. So you can kind of understand what that puts on us as far as transportation. Now, let me go ahead and say with this, is once we know the survey, then that kind of helps out because I have the most restrictions. We are only allowed to have 23 students on a bus. The maximum could be up to 27. That's if they're in the same household, and I'll get to that in a second. We're allowed one child per seat. The reason why we're leaving one seat open is due to the fact that during our time frame, these students will need to be wearing masks, and also that there is hand sanitizer, a flammable liquid, that is now on the bus. So we would hopefully try to be able to work it to where we would have a monitor to be on that bus to assist the bus driver. The other reason is the bus driver, to kind of put it in perspective, the amount of hand sanitizer is about the size of the bottle that is over there by the plant. So that is the exact size that we would carry within reason during that time frame. So like with anything, if you're giving out any form of medication or anything to a student, you would want to have somebody else besides the driver. Because as you can see, time would add up as far as that would go, doing that for every single student as they were coming on. Okay. So it is very imperative that we need those ridership numbers so we can balance out our ridership. With that, the hard part comes into play then is the logistics of what we have to do. It took us 2 months to get consolidation routes with no constraints as far as anything else. Now you have the constraints of 23 students per bus. So you can kind of understand transportation right now is not going to look like it has in the past. We cannot do that. For the mere fact of contract tracing, which Ms. Stephanie will talk about later on, students will not be allowed to switch buses in the AM and the PM. What bus they ride in the morning is going to have to be the bus that they're going to have to ride in the afternoon. Same thing with car riders. We just can't afford to go through all the permutations that it would entail to make sure that we're going through to get these students both to and from home. It becomes a logistical nightmare, just to be quite honest with you, and we can't do that on the fly like what we used to do in the past. Just to put it in perspective, we're going from 72 students per bus down to 23. So you can kind of see where we're at as far as capacity. Also within that, contract services will be providing for the exceptional children. That is actually a benefit for us, as we've had some of the contracted servicers might have had to go look elsewhere to ensure that their vans are going through. And those vans still are only allowed to have 2 people per van. Dr. Emmanuel, those are also being cleaned per the guidelines of what we are following as far as driver's education. And that's actually been going through and been tested, and we've been doing that with RCC students. So that has been really working well within our contract drivers and how they're handling those type of situations and the training that they needed to go through. So that's actually quite well. Students, we're asking them to make sure that students do not switch. So when a parent elects to go fully remote, they need to stay fully remote. We can't a month later. That will put our routes in chaos. Like I said, it took us 2 months to do consolidation. With this, in the time frame we're in, we're looking at about 5 to 6 weeks to be able to get through, to be able to have bus routes. So you can understand how one person coming through. Now, I understand we're going to have students coming into our district and leaving our district, but that's a different situation than trying to somebody change from one to the other. So hopefully you can understand that. The best way to think about routes, we're going to have to double runs. What that means is one route now in the mindset becomes 2. Some of our buses also already run double routes already, so 2 becomes 4. We have in certain situations in this county, like in Red Springs and certain other areas, that one apartment complex has 52 kids on it. So you can understand I'm going to have to make multiple routes just for that one location going through. That's why it's imperative, once we get the results of are they coming back or not coming back, then we can go ahead and push through with the routes of what we need to. Because if we don't, we're going to be doing just as much double work trying to go through and rerouting. I already addressed the monitor on the bus. The other concern that we're going to have as far as with transportation, we're going to actually put through, there's a 1-page to 2-page that we'll put on the website, but we in transportation are going to do a 15-minute orientation video that will be made to the public. Because our route and everything is going to look differently. For example, since I'm only allowed to have 23 bus riders on a route, the first person that comes on the bus will have to sit at the end of the bus where Mr. Leach is. That is so that we don't have that person. If we have that person where Dr. Emmanuel is, then everybody going past Dr. Emmanuel is going to have to keep going past Dr. Emmanuel, and we're increasing the amount of possibility that she can be infected. So we would do it that way. And then as we unload at the school, front goes to front to back like we normally do. But however, in the afternoon, we have to flip that process. So we're able to do that though with our Tim's routing, and that's why it's going to take us a little bit longer, because we want to make sure that we're doing that properly to make sure that that student then who's sitting in the front, first person on. The next person, then instead of Dr. Emmanuel, Mr. Brewer will go next, then Mr. Leach would go next. So we have to reverse that process and make sure we're doing so that we're decreasing the amount of contact tracing, possibly issues with contact tracing that Ms. Stephanie is going to discuss. The other concern that we have is, as you know, we only have 260 yellow buses within our fleet. Right now, we currently have 60 buses that are out there, 39 doing Wi-Fi and about 20 doing meal service. So we're going to need to utilize those buses that are also providing those services. So we're going to have to work in conjunction with Ms. Locklear on what lunches are going to look, because those schools that are in session won't be able to provide lunches for one, and then also provide enough lunches to go onto the buses to go through and go out. A prime example is this week we had to add a third bus to Carroll Middle School, because they're putting out, if I remember correctly, about 1,800 meals a day is what they're servicing. So we're going to have to shift, as well as we'll talk about Wi-Fi later on, but we're going to have to shift with Wi-Fi as well to make sure that we get the students in and then mitigate what those services look like afterwards.
Questions?
Questions?
Okay. Mr. Henry and Mr. John went up about the same time. Mr. Henry, we'll go this way this time.
You had mentioned the child has to ride the same bus. The, assistant helping the bus driver, will that mean they'll be taking roll call?
They can. The main reason for that is to make sure that we have contact tracing as a we're making it tighter and that students are being monitored, as well as with masks and other things, to make sure that those students are there. It also helps. Basically, what's going to happen is we'll have the attestation form, because we cannot do temp checks on the side of our roads, not here in Robeson County. So we're going to have to accept those students, take them to school, and then they'll be temp checked at the school.
My question is, if you pick up 23 students in the morning and maybe one got sick or something, had to go home, what's the follow-up plan?
That's the vitalness of not only the route sheet that the bus drivers already have on there, but that extra hand-on would also be able to help with delineating and expediting.
Okay. Mr. John?
Being that you're going to have to make mobile routes, my question would be like, how early are you going to pick the kids up? And how late are you going to get them back home?
That's something, another reason why, to be quite honest with you, when the question just happened about what grade levels, the older the grade levels, the harder, the more grade levels we have, the longer it's going to take. Literally, we could have go from sun up to sundown. The hard part is that as we do that, we've got to include time for cleaning, as well as what we have to do for turnaround. However, that's why it is imperative that we know who's riding and who's not riding. That's why we can't deviate and switch. One day you're here, one day you're the other. We need to have the cleanest as possible so that we can ensure that we're running those routes as effectively. Just like some of those might have full 23 on the first load, but based on one school might not have but 12 on the second. What we're planning on doing with that is starting with the farthest out, the longest route, go first so that you're quicker coming in. Does that make sense? So the quicker routes are run second, so that you're kind of doing with your time that way. That's the best that we're going to be able to do that. As far as starting, we might have to talk about staggering sometimes, and what that might be, especially going home. Because remember, getting them there is one thing, but then at the end of the day, getting them, meaning the students, onto the bus, you have to stagger them getting on the bus, as well as stagger car riders getting to their vehicles. And so that's going to look different at one school than what it might look in the other school.
Okay, do you have a backup plan? I know it's on pre-K, you can't drop them off unless someone's there. Do you have?
Correct. And that would still stay in the same place. The other reason why somebody asked is we might have to pull other drivers from the middle and high school to help with these routes. That's going to happen.
So that's our contingency plan, is to pull those buses that normally would be at the middle school and the high school to put those there. However, there is a caveat that I want to make sure that I let everybody aware of. There was a change last year in the background check required for bus drivers, especially those that drive pre-K. If there is one pre-K student on that bus, just one, this driver has to have a different different background check federally to make sure that everything's okay. If not, then we have to put a monitor on that bus, which that's also an impetus to have that. That's another reason why less grade levels, the easier we can manage that and to be able to mitigate those circumstances.
Okay, Dr. Emmanuel?
I have two questions. You said that you could use contract services. Now, my question is, who's going to pay for that? Would it go over and beyond any money already allocated? It might be an Erica question, I don't know.
No, ma'am, because
EC funds.
if those are out of EC and those.
Talking about EC services?
Yes, ma'am.
Okay, my second question is, and maybe tell me if I understood you wrong. It looks to me like the remote learning children are going to have to lose something if they lose a Wi-Fi bus or if they lose the lunch buses, because you said you may have to relook at those Wi-Fi buses and the lunch buses, you may have to use them to transport children to go to school. So did I misunderstand that?
No, ma'am, it's going to be a reallocation of those resources.
So what does that mean? Does it mean that the remote kids may have to not get as many services as they presently getting via lunch, via Wi-Fi?
That would be dependent on the amount of bus routes that I would have bringing students in, but hopefully also that would be absorbed by high schools and middle schools picking up those extras. So whereas I'm just throwing out a school, okay? Just throwing out, doesn't mean that they're in that mix. Like, for example, if Oxendine comes back as a pre-K through 3, Oxendine can't do their food services. So we're going to have to pull another school to do their food services to ensure that a bus picks up those routes or those students that they would go ahead for.
So you're comfortable saying that you think you can reallocate resources so the remote learning children won't get the short end of the deal? They won't lose the lunch, they won't lose the Wi-Fi services. You feel comfortable you can reallocate resources to do that?
But it's going to change what it looks like, especially Wi-Fi, what it looks like right now. I can't 100% because I don't know who's coming back and who's not coming back. Because some of these routes might be shorter than what we're anticipating. Some of these routes might be longer and we might need to go through on some of these smaller ones to be able to pull those resources. So to be honest with you, ma'am, I can't 100%, but as much as we prevent anybody beyond right now adding pre-K through 3, nobody beyond that, it allows us a lot more confidence to be able to make sure that that happens.
Mr. Brewer? I got Mr. Brewer in the mic.
I have rode around and looked at the Wi-Fi buses, and I don't think we're getting the participation that we thought we were going to get with the Wi-Fi buses, especially since the hotspots has went out. So I don't, Dr. Emmanuel, in reference to your question, I don't see the Wi-Fi buses being a big deal because of the hotspots. And also my question to you, Dr. Guzman, is, do you think the scheduling of the buses is going to affect the class hours? Is it going to change any at all? Do you foresee that?
Depending on the runs, yes. Getting there, to be honest with you, is going to be a lot easier than getting them home. Getting them home is probably going to take the longer aspect of everything. But then again, that's also going to be predicated on the amount of staffing. 32% of our bus drivers are 65 or older. So with that being said, there might be some. All right.
Wayne, you have a question? Okay.
I'm good.
Okay, Mr. Mike?
Dr. Guzman, a while ago, you made the statement about the children getting on the bus, that they wouldn't take their temperature.
We have, what has to happen, sir, per the CDC guidelines is that you have 2 ways of doing this. You can either have the child produce an attestation saying that the parent is attesting to Those 4 questions are already been met and that their child does not have a temperature. By having that attestation, but there's questions even at the DPI level on having that attestation. You have that attestation, the student then can board the bus. But regardless, then the student, when the student exits and deboards that bus, they still have to have their temperature taken at the school. Now, if we don't, then what we have to do is definitely have to have a monitor on the bus and then have that monitor come off the bus, take the student's temperature, and then allow that student on. Now, where it also comes into play is under the regulations, we are responsible to make sure that if a student has a temperature during that time frame, or answers one of those questions in a situation that makes us where they can't board that bus, we are responsible to ensure that that student gets back home safely at that time. So then somebody has to stay there with that child, and either that bus waits until somebody comes, or that bus leaves and that person is with that child.
Yeah, yeah, that's not gonna happen, especially pre-K like you're talking about. Somebody's gonna be there. I know the other week when we went to Richmond County and we looked at what they were doing, they checked every child before they got on the bus. I mean, I don't think you want to put a child on the bus and they running a high temperature.
I think they did that.
That's just me. I think you need to go ahead and cut that off up front. That's just my opinion.
In other counties, what they've done, sir, is to do the attestation, because regardless, they're still gonna, it's one of those also with some of our stops and where we are on the roads and everything. You've got safety issues, especially with time and darkness and things like that, that I just don't feel comfortable. To answer, sorry to not on a side, Mr. Brewer, sorry, as I was not ignoring anybody, I was typing into Cradle Point. As of right now, as of today, we've actually got at least 2 good full weeks of information based on our Wi-Fi usage. There's averaging about 95 clients per day that are utilizing our Wi-Fi buses, with only about 271 total clients. That's one ISP address per person, so only 271 people are utilizing or have utilized those Wi-Fi buses with an average of 95 per day.
And I want
Go
to
ahead.
add to what Mike referenced. As far as the temperature on the buses, some school districts have taken the temp at the door to the bus as they
Right.
load the bus. But the majority of them that I've read, they take the temperatures at school. And we ran into some situations today when we were talking about taking temperatures. Because if you're using the machine like out front, when you come in the mornings, you have low temperature. And that's about 3 times. So if the buses come in, those kids who ride the bus, if we're taking that temperature and it's December or January, we're not going to get a good reading. So we've got to work on something with that. As far as car riders, the temperatures will be taken while the child is in the car. Because if it has a temperature, then that parent is there, they can take them on home.
Okay, Mr. Terry, send your hand a while ago.
Dr. Guzman, this seems like a well thought out plan. I can tell that a lot of work went into thinking out.
Terry, speak up a little bit.
I can put it, a lot of work went into thinking, and thinking about all of the pieces that went into this. My question is, with all of the caveats and limitations and rules and guidelines and that sort of thing, is there going to be a system level tracking system, or is each school kind of responsible for keeping up with who's supposed to be where and who's, that sort of thing?
I'm glad you brought that up, sir. We, through the CARES Act and your work, have able to get GPS, which will be installed on all of our fleet buses starting on Monday. So we will be able to know every single step of the way within 2 to 3 feet where those children are. Now, also within there with the COVID package that we have, students would be able to, if they had student ID, to be able to, as they boarded the bus, scan it, sit down, so we would know exactly who was on there. Now, that's something that we could do and move through as we're talking about the other minutia, but that will already be on the bus. So we will be able to then definitely track from one location to the other, exactly where that kid is, that child, at any given point in time while they're going through that, while they're on that bus route. Also, with the system that we have, our checks, there is a tablet on the bus that the driver will be able to have to go through that would also do the checks. So we would already know when the bus was cleaned, who cleaned it, what got checked through, and all of that electronically, so we're up to the minute. Does that kind of help out with that too, sir?
So we're going to have that, that's something that we're going to have in place by January?
Yeah, it's starting to, installation will start on Monday. The team from Atlanta will be up here, and hopefully by the end of November, we will be able to then start training all the schools to be able to look up that information. Because those schools will actually be able to look at exactly where that is. So no longer will it be, you call the school, I don't know where the bus is, it could be here on this time frame. We will have that capability within 2 to 3 feet to be able to tell where exactly that
So
bus
we
is.
have the GPS and the ID scanning?
Well, we would then have to have the students have the ID, but we have that capability already built in to be able to run that.
That's the piece that I'm most concerned about is, you know, the actual number of children that are supposed to be on it, you know, and trying to keep up with who's supposed to be on it versus who's not and that sort of thing.
Well, with that, within the first couple, we do that every year anyway with our bus manifest that we have to go through with the bus route. It would be just that more critical that those schools, especially those drivers, keep those up to date as they're going through. Right now, we do that paper and pencil. That's why we couldn't have Mr. Leach get on the bus this morning and then go to Mr. Lowry, who's principal of school B, and say, I need to ride this afternoon bus. Well, in the past, if they had and we could make it work, we made it work. Now, we can't really do that because then if Mr. Leach gets on the bus or is not supposed to get on the bus and his parent shows up at school without even GPS, you can kind of understand the quandary that we were in the past.
Dr. Guzman, let me go back a couple of things. The Wi-Fi information, and I'm gonna say from now to January, there's time to even get more. But I will say, to me, getting those hotspots has helped with not having to use the bus situation as much. Now, with the Wi-Fi, the numbers you have, did we send out more than one bus per school? Do we have more than that out?
What we've done is we've tried to make sure, kind of like Ms. Brooks Floyd wanted us to do, to make sure that there's community building. So meaning that in one location, if I could, Mr. Terry's one school, so we're taking Mr. Terry's Oxendine bus going there for the first couple of hours. Then Ms. Freeman's bus from her school is coming over to help cover that others, that to kind of flow in and out so that we have some overlap, especially from once we found out which churches would be able to, as well as where the signals were good, as well as parking lots that could have been big enough to be able to accommodate not only a bus, but the crowds of people, if in fact that's what ended up coming.
And the other thing I would add, and you mentioned it, so we definitely would be working toward, we're doing pre-K, we got the pre-K 3 drivers. But then if we jump up and go get high school drivers now, since that would probably be the last group going to work, if we go get them, put them doing the routes, that's going to shorten that time in the morning and afternoon. And if we don't have enough of them and we still got buses, we can go on down to the middle school because hopefully we'll be bringing each of those back at a later date.
Correct.
Now, once they come back, it could cause us some issues, but that would get us started.
And then that's also the reason why I can't fully 100% commit to Dr. Emanuel's, because if we get them there quicker, I might not start the Wi-Fi bus at 8. I might be able to start the Wi-Fi bus at 10 or 12. In the evening timeframes, I don't see that being an issue, but then it's also making sure we have drivers available for Miss Charlene to go ahead and make sure that. So it's just trying to make sure we have all those first resources and then be able to move those pieces as we need to for those other 2 services that we provide.
Okay, Mr. Brewer?
Do you foresee having enough of bus drivers? I know during the feeding, nutrition program during the summer, we were staggering drivers so that they couldn't drive over their allotted times each day. Is that gonna be a factor in this, or?
We have a bus driver shortage. We're no different than any other county. But the more we have bus drivers going around into other areas, the harder it's going to be. We're currently right now, and I'm sure Erica, please feel free to chime in at any point if I misspeak. We are authorized to use my budget of 056, but however, thankfully with Erica, with what she's doing, she's paying those with other funds to make sure that we can go ahead and continue what we're doing. Will there be overtime issues? Yes, we will have overtime issues. Right now, the other problem is that if we have, as anywhere with Stephanie, and I don't want to steal her thunder with the changes in contact tracing and everything, we've had to shift around feeding sites, meaning a whole cafeteria has to have been shut down to move it to another location. So yes, we will run into those issues. We already are dealing with a driver shortage as it is. We've kind of talked, Melissa and I, as well as some others, on solutions to that, but those are also long-term solutions that COVID just has exacerbated the current problem of what we're having. That's why it would be imperative, sir, that we remind people that what decisions they make outside of the scope of work. You also got to remember a lot of our bus drivers are dual employees. You know, they do multiple jobs here within the public schools of Robeson County, or we also have a lot of bus drivers that have 2 jobs. So they might be going to their second job and get COVID or be exposed to COVID in their second job that we've got to make sure we're dealing with here that has no bearing on us other than if they do come in contact with their other job, it then takes us out of the loop to be able to do with what we need to do.
Okay, we'll get Mr. Terry and we'll move on to the next presenter. Mr. Terry, I think you had your hand up.
So what does a attestation look like? How do you envision that taking place?
The state already has given us the form, so that's an easy form that we can give out. The question then becomes, some districts are doing it for the whole entire timeframe. So meaning I give you one attestation and it's good for the whole entire time and it's kept at the school. Other school systems are actually doing where if it's this week, I get Monday. You rip off the Monday paper and you come due Monday. But then it'll come into play as if that child brings it to us on the bus, and let's be honest, if it's in their backpack, gets lost, folded, spilled on, we're still going to probably err on the side of taking that child rather than to leave that child on the side of the road or getting that child to there. Most of them also, like I said, through DPR in the schools, has it there already in English and in Spanish. We could translate into other languages and then be able to hold on to those.
Okay. All right, thank you. Next, Ms. Stephanie?
Good evening, Chairman Lowry, Superintendent DeFreeze, and board members. I'm going to go over the COVID-19 update. And first, let me make sure I do this. 2 things. Prior to the meeting starting, I was having a conversation with Dr. Emanuel. She had some questions about our guidelines. So what I went ahead and she asked me to share that with the board members. So the updated guidelines that I will talk about that was updated on October the 8th, I went ahead and sent that in an email to all the board members. And then I wanted to add to the conversation earlier about the decision with pre-K 3. As Dr. Emanuel was stating, another pro with that population of students, and this is from the American Academy of Pediatrics. So it states children younger than 10 may be less likely to become infected and less likely to spread infection to others. So that is another pro for that population of students as we look at reopening, starting with a smaller population. Again, as Mr. Free stated, it is crucial for that population of students because of early learning, and they need to have that exposure to in-person learning. I wanted to share that. So again, with the updated guidance, there was 3 main components out of that information that really impacts the work that school health services does along with school administrators. The first one is CDC updated how they define what is close contact. So initially, we was working with that sustained 15 minutes of being exposed to someone who was positive with COVID. Now it's an accumulation of, it can even go the day before. So if I had a 5-minute conversation with Dr. Emanuel yesterday, 10 minutes today, that they will take that time frame and accumulate that 15 minutes or longer of being exposed. So whereas we were excluding folks here, it has really greatly expanded our parameters. So as Dr. Guzman has touched on, areas where it has really has been very challenging has been with our bus drivers and our cafeteria folks. And so as we spoke with the principals today, that is one of the key strategies as we mitigate our reopening plan, that we really make sure we are monitoring and surveillance in that piece with social distancing. The second one was for any person, so if we, is household contacts, that's like a new term that we're looking at. So if we have a symptomatic person with COVID-like symptoms in the home, any person that is associated with our school setting will have to begin the quarantine process until that individual who was symptomatic is cleared of their COVID-like symptoms. So if you have a husband and wife who's affiliated with PSRC and their children, that's 4 persons already that is excluded from the school setting until we can determine, okay, is this person, because they look at it as a potential COVID case. So until that person is cleared by their healthcare provider or present a negative, what we call a negative PCR test, which is the gold standard in testing, then those persons are cleared to return to work. And lastly, which we see that's going to be kind of tough to regulate, is for any person, staff or student, who is symptomatic with COVID-like symptoms. If they have a negative rapid antigen test, it must be followed up with a negative PCR in order to clear that individual to return back to the school setting. So once we was aware of this updated guidance, I immediately told the school nurses to have that conversations with the school principals and go ahead and let that be, implement that piece. So when you have conversations with staff who has had an exposure, or when they're making that decision to test for COVID, that they are seeking out that PCR as that first choice. Because if not, you're going to be having to test twice, essentially. Here I wanted to share our Public Schools of Robeson County dashboard data. So for the month of October, we had 210 exposures, along with 47 positive cases. And earlier in the month, we did have 12 student exposures and 1 positive. And that was due to some athletes on campus. So as you can see, at one time, we had 257 staff between the 10 and 14-day quarantine/isolation was not on our campus. Next, here we talk about the North Carolina Department of Health and Human Services dashboard. And here's where we can find our positivity rate for the county. Today it's 11. And we have fluctuate for the county anywhere from 9 to 12.8. CDC recommends about 4 or 5%, where it's a lower risk for transmission, but when we go back to our slide here, as we talk about those, 5 key strategies to mitigate our reopening process. It does sound so simple when you know your 3 W's. But as it states, that it's just critical. Wear your face covering, social distance, hand hygiene, cleaning and disinfecting, and contact tracing. Those are our 5 key strategies to reduce spread within our school. Because with contact tracing and social distancing right there, and along with communication, if those staff report, hey, I'm not feeling well, staying home when they are sick, those right there, are one of the top 2 things that we can do to prevent someone coming on campus and exposing others and hindering, the work that child nutrition is doing, and along with our transportation, even with our teachers, because we won't want to impact, exposing a team of teachers as well. Also, lastly, we have our PPE booster pack. So of course, the start of the year, we received our PPE starter kit, but now the state's going to provide a booster pack, and it's a 2-month supply. And once the board and the district makes a decision on when we plan to reopen, they will place our order for our booster pack, and that will include procedural masks and face shields. Okay, you have any questions? Yes, sir?
Is that for students or is that for everybody?
That would be, the booster pack would support, the school nurse and the designees that's going to be working in the safe room. So it's 80 procedural masks for the school nurse, 80, they say the school, but it would be any of those persons who would be working with symptomatic persons, whether if it's a student or child. And then the face shields are 6 for the school nurse and 6 for the designees, and they are reusable. As long as you wipe them down, clean them, and store them properly, you can increase the usage out of those. Out of some discussion earlier, we did identify some other times when like isolation gowns should be worn. So we're going to look at purchasing some of those. So for our students who have a bowel bladder program, and we would, for isolation gowns, and then for students who were for medication administration, we would look at those persons wearing face shields, because you're going to have to remove their face mask and do their asthma inhaler or taking liquid medicine or whatnot. Then we will encourage those folks to wear face shields when carrying out those tasks.
Devontae?
Yes, I got a 2-part question. Now, when we open back schools up, we're gonna have positive cases. There's not gonna be if, we are gonna have cases, we are gonna have exposure. My thing to you, what is our plan when a teacher in the classroom or a student in the classroom expose everybody else around them? That's number 1. Number 2, when we're at a school, how many positive or cases and stuff are we gonna have before we say we shut a school down?
Understand. Okay, so with, and that's when we will definitely work closely with the health department. So here, and it even states that, so with our reference guide, so in this tool here is our protocol that we would use in the event that a staff or student was exposed, or if they got a diagnosis of COVID-19. And it even says in there for closures, it says here, close off areas used by the sick person and do not use these areas until after cleaning and disinfecting. And it says consult with the local health department as to whether closure of a classroom or entire building is required. So based on that scenario, and that's where the contact tracing investigation is critical. And it can even be an LEA decision, because if I'm teacher and you are my students who are, if we're following the guidelines, face coverings, we're 6 feet apart, with the health department say, okay, Stephanie, your district needs to send, based on that classroom roster, you need to send home X amount of students. Or would the district say automatically, if we got a teacher who tests positive, that whole classroom is going home for 14 days. So, it'd be a recommendation from the local health department, or just be a decision, just to err on the side of caution. We're going to just automatically send that entire classroom home for 14 days. Based on if we had multiple cases, or if we're looking at a cluster event in that building, they may say this building's going to have to go home for X amount of days, or something of that nature. But we would definitely consult with them.
Roy?
What, do we have any plans?
Mr.
Do we have-
Lowry.
Got one question, Mr. Smith, then I'll get you.
All
Do
right,
we
thank
have-
you, sir.
Yes, sir.
Do we have any plans in place to ensure that our kids will have masks even when they maybe enter the bus? Will we provide those?
The state has, and that's where, did our mask come in? Okay, so the mask from the state, that was part of the,
Exactly.
I've got a little rusty now. I think it was 5 per student.
Yes, 5.
Okay,
Here's
so
that.
those masks have came in, and they're at the, Mr. Mercer has those. Those will be dispersed, once our student arrive on campus. And then part of the plan is to have masks on hand in the event that, a person don't have a mask, but you did bring up a good point about even having one on the school bus. Because in the event, if one was, because it's happened to me, my band has broke. If it becomes soiled, moist, or damaged throughout the day, we do have masks on hand to replace, that for a child or student or visitor.
And Mr. Burr, to add, we have discussed that with Mr. Mercer as well as Mr. Freese and our other meetings prior to this, ordering more disposable masks to be on hand so that we are able to disseminate those. That would be another reason why we would also be kept off one person and has 23, so that will endure to be able to be inclusive.
The CARES Act.
Dwayne?
CARES Act is PPP.
Yes, sir. Can you hear me?
Yes.
Okay, all right. Let me ask you this here. The kids K through 3, when they're in school, they're going to be wearing masks, correct?
Yes, sir.
Yes.
Okay, all right. If they're going to be wearing masks, what kind of timeline do you have on in between there? So, like, is it going to be, they're going to be taught for like 15 minutes, 20 minutes and taking a break? Or how is this going to work? Because the time span of a child, and this right here happening, how long do you think a child's going to sit in a classroom with a mask on for 45 minutes or an hour or 30 minutes or whatever? So, has anybody thought about that?
Yes, we have, Mr. Smith.
Good question.
The K-3, what we are looking at is after a period of time that the students are in class to have a mask break. That's in everything you read. that the kids will have a mask break. They even tell us to take them outside, keep the distance. And that's a good time for them to have their mask off. Or in a
Right.
space like the gym, and they're spaced out. Ventilation is key. So there's a lot that's going into this.
Okay. All right. Well, I hope we're working on that with the board next weekend too, because I can only take about 30 minutes and I'm getting fidgety myself.
I understand. Mr. Brewer?
We have monies in the CARES Act to buy additional PPEs,
Yes, we do.
and can we go ahead and follow up with that?
In fact, we got the nicest email over the weekend. I think it was $123,000, Erica, in addition to our CARES Act money.
98.
So,
98,000.
yes, so we have money to make sure that we have everything that we need.
Are we gonna go ahead and order those up?
Oh, yes.
Okay, Ms. Stephanie, anything else?
That's it for me.
Okay,
Thank you.
thank you.
Thank you.
Who's next? Commercial? Mr. Mercer, as you come in, I know this is being viewed. Let me make sure the public knows. We have the board members that are here, and Mr. Dwayne Smith is listening virtually, so we do have 8 board members who are present. Go ahead, Mr. Mercer.
Good afternoon, board members, cabinet, Mr. Freeze. What we have done, we have devised a manual to help the custodians and the principals clean the schools. It's a step-by-step manual. It goes into, from A to Z on cleaning, and the floors, everything, the bathrooms. And it goes step by step. It tells what we expect to disinfect the classrooms before we come in with the Clorox machine or any kind of other disinfectants. You have to clean first. The cleaning products that I have, they're listed on the back of the sheet. The ones in yellow are COVID approved. SDS is on file also. The principals and the custodians all got a copy of this. We also designed a bathroom cleaning log and a classroom cleaning log. And what we expect the principals to do to check this periodically to make sure that the rooms are clean, being cleaned properly. We went through, we purchased 7 of the Clorox machines, the disinfecting machines. We've got 7 of those. I've got 2 in stock right now. They promised me 8 weeks that we would have the other 5. We've got about 2-3 weeks left to have those. We purchased 52 of the handheld disinfecting machines, which are the cordless machines. They'll use the cleaners that we've already got on hand, the Hepsite Quad. They'll just pour that in there. They are rechargeable and they're cordless, and each school will get one of those. Soon, we'll have those within probably 2 weeks is my estimation. I purchased hand sanitizer stations like over there on the side. The high school's got 4, all the smaller schools got 2. They're able to get more if they'll just contact me and let me know what they need. We purchased 200 with Miss Erica helping us. Also, we talked about the custodial budget. I know that's been a big concern. Miss Erica and I talked about it. That is virtual money. It's not really where the schools have to pay us back for the product. It's a checks and balance system where we keep them from wasting a lot of money and spending a lot of extra wasted money that they don't need to on custodial supplies. So we talked to the principals about that, not to stress that as much as they're stressing about getting running over their custodial budget. They have a dollar amount that they are allowed to spend every year on supplies. So we talked about that and we discussed that, and we'll do that on a case-by-case basis if they start to go over, but we told them not to stress it. That's what we talked about today mostly. Any questions?
Mr. Lowry,
Yes.
I think one thing that we need to address is I think that there also needs to be a meeting with the custodians and they need to be on key on what's going on right here. Cause I'll just say it, we got some lazies in the system, and they're gonna have to step up to the plate, and they need to know what's going on. So I'm just saying, I wouldn't put it on the principals to sit down and talk with them as much as it needs to come from higher up, and they need to know what needs to be done.
Okay,
I had a class with all the principals and all the custodians. There was 13 principals that missed, but they're rescheduled on November 5th. We went over everything in this manual and they've got one. It was about an hour and a half training class. So as of November 5th, everybody in the district, principals and custodians, unless somebody misses the 5th, everybody will be trained on what we expect.
okay. Dr. Manuel and Mr. Brewer. Dr. Manuel?
Mr. Mercer, I think what you've done and what the system's done is a great beginning. But in my many years of teaching, there is no way a teacher can wipe down those desks after lunch, before lunch, after they come in and teach. There's no way that a janitor can clean those rooms and cut 7 acres of grass without extra help. My question to you is this: what are we doing, if anything, giving them some help to sanitize and clean rooms? Now, I know you said we've got Clorox machines, I understand that, but it takes a human to run that.
Yes, ma'am.
I expect teachers to teach, okay, and make sure those children are safe and don't get hurt. I do not expect teachers to wipe down desks 3 hours a day. My question to you is, has there been any effort anywhere by anyone or any fund to get some extra help at those schools, be it part-time, to help sanitize and keep it clean and safe for children? Because we cannot depend on teachers to do it. They have to teach.
Yes, ma'am. I don't know of any. No, ma'am.
And this is not your fault.
No, ma'am.
Not.
I know it's gonna take a team effort. It's not custodians. They can't do it.
They can't do, they cannot wipe those
Principals can't do
desks
it.
down.
Yeah, it's gonna have to be teachers, it's gonna have to be bus drivers, it's gonna have to be cafeteria, it has to be everybody. Is on the way.
Because I know, and I'm thinking of one specific school, they have acres and acres of
Yes,
grass.
yes,
And
ma'am.
they can't, there's only so much a human can do. And my worry about coming back to school is I know we've made an effort to go in and clean it, disinfect it with the Clorox machines. But this has to be continuously done, every day cleaned. I mean, those desks cleaned.
Yes, ma'am.
And that's where I'm coming from. What do we have in place to help those janitors and those principals help maintain a clean, safe environment that we can keep this COVID at bay in the classrooms, protecting the teachers and the children? And I don't have an answer. I'm asking you.
No, ma'am. I don't have one either. Most of the schools that I've been to, other districts, and I'm just a rule of thumb, they do 1 custodian per 100 students. We're at 200 per 1. So you're right, we are understaffed, but I don't know what the answer is.
I don't know if you go to, and I'm gonna take up over here for Mr. Smith, St. Paul's High School. It is just a scenario that I've never been able to understand how they're allocated there. But I guess my concern is, and I want the kids back in school, and I don't know anyone that doesn't, but I'm very worried about keeping it sanitary and clean for the staff and the children.
Yes, ma'am. The best I can do is get them good product and get them something easy to use, and that's the best that I can.
And that's a sound beginning.
Yes,
It
ma'am.
is.
We try to make it as easy as we can on them. I know the principals are overworked and they're understaffed, we know. We can just get them the best product we can, not get them cheap product, where they have to clean twice, something that's, more sanitary and safer.
But it's a fact, teachers can't clean all day now.
No, they cannot.
Brewer?
I actually have 2 questions. The machine that you have, is that a spray that you spray, or is it a wipe down process?
Both of them are just sprays.
Okay, is there a particular time on your check sheet that has to be done? I'm sure we don't want to do it before kids enter our classroom, do we?
Well, the way the Clorox machine works, and keep in mind, This machine does not replace a custodian cleaning. This will only disinfect where he misses. After you spray this machine, you can go in a classroom 2 minutes.
Okay.
So you could, I wouldn't recommend it. I would probably, if you've got, especially like kids in the classroom all day, the same kids, Stephanie, correct me if I'm wrong, you probably could just clean the end of the day and spray. But
Right.
that would be, whatever we decide.
My second question was the ventilation systems. I know in the first, we first started talking about the COVID. We said one of our requirements was going to be that all filtration systems were adequately cleaned. Do we have a process to make sure that's been done?
That would be on Mr. Ernie. I know that, because all I do is order the filters for them to change. We have Tracy Locklear, which is our HVAC supervisor. He's went to every school and trained the custodians how to change the filters, and they're supposed to be changing them every day, and he keeps a log of that, if that helps.
Mr. DeFreeze, then Ms. Turner.
Talk about the fogger, the machine that we have purchased for the schools to use.
Yes, ma'am.
Tell us a little bit about that machine.
What that machine does, it's a chemical, and you get about 6 feet away from, and we're actually have anybody that wants to go. We're having a training class November 5th at 10 o'clock at the warehouse. The Clorox rep's gonna be there. He's gonna train the principals and the custodians that missed the first class. But what it does, you get 6 feet away and it sprays out a mist, and it's electrostatic. It's just like powder coating, if you know how that works. It electrocharges the item, and then when you spray it, it sticks to it. Like it'll go under a desk, on the legs of a desk, everywhere. It just sticks. So you don't, places they're gonna miss and not wipe, this will correct. The small guns do the exact same thing, just on a smaller level. And they'll be at the schools 24/7. They'll have their own machine.
Ms. Terry.
Are we making sure that we're ordering, when we're ordering like disposable face coverings or disposable masks, that they're COVID compliant, or that they're being ordered based on the recommendations by the CDC?
Okay, like if it's 2-ply, 3-ply,
Right.
or whatnot.
So I'm hearing that, the one ply, that it's not recommended that we have, 1 ply for COVID. So at least, is it 3 ply?
On the N95 machine, then when they use it, they have to have an N95. I have plenty of those. I don't know about the paper mask. I just got instruction on to order a bunch more paper masks, so I'll take a look at that. I'll do some studies on that.
We'll take a look at that.
Yeah.
But I was just thinking when you said that, Mr. Terry, is, I think some good practice for the custodians would be to use a disposable mask when they are cleaning, so they can dispose of that and then transition into their cloth face covering. If not, just utilize a disposable face covering throughout the day.
I think on my last count, I think I had 100,000 cloth masks still, and we still have not got our second order. I think FEMA has promised us a second order, so we still got masks cleaning.
Okay. Thank you, sir.
Yes, sir. Thank you.
Mr. Bobby?
Good evening, Chairman Lowry, board members, Superintendent DeFreeze. I'm going to touch on some things, pretty much try to pull everything together. So the first thing I'm going to talk about is the signage. In our reentry plan, it requires us to have uniform signage across the district. So we did a survey a few weeks ago with our school administrators and requested the number of signage per school. So here are the proofs that are going to the printer. Most of these are in both languages, English and Spanish. We tried to use the school colors as much as we could, the blue and gold. So again, hopefully, after you guys look at this tonight and kind of say yes, then the printer's going to get started on these, and we're going to get these out to the school immediately as soon as they come in. This is probably the first thing we're going to ask him to work on, and this is our sandwich board, and this would go at the entrance of every school building. So it kind of tells the public as they walk up what the expectation is within that building. Next, I worked with Mr. Mercer and we ordered traffic cones. The reentry plan calls for our schools to have one-way hallways. Not all of our schools can do one-way hallways. So we've ordered the 4-foot cones. We're gonna work with the principals and we're gonna use those cones to divide the hallway in half. We had discussed possibly putting rope or some type of tape on those cones, but there's another surface that a custodian would have to clean if we did that, because, you know, kindergarten's gonna want to rub their hand down the chain. So again, those are gonna go out to the schools in the next coming days. Mr. Cole, if you would, this is probably the hard work that principals are gonna have to do over the coming weeks. All of you have seen our school reentry plan, and as the team worked on that, we kind of said, how do we make this document live? How do we make it real for principals? Because principals can pick up that 40 or 50-page document, and there's a lot in there. But what do we do to make it real? So what we did is we went through that particular plan, and every place it kind of made a statement of, the principal needs to do this, not in those direct words, but it just said that the plan needed to be in place. We lifted that off and put it in here. So I'm going to talk in just a minute about like Dr. Guzman. It's just not those kids arrive on campus on that bus. It is who's going to be there checking the temperature. Are you going to have that attestation form every day? Where the bus is going to be at? Again, some schools are going to have more bus riders than they have car riders. According to Ms. Stephanie's documentation, it takes about 30 minutes for one person to do 100 temperature checks. So with that knowledge in place, principals need to know if I've got more bus riders, of course, I've got to place more staff back at the back of the school and take care of my bus riders. If we think about a school that has a lot of car riders, how many folks are you going to have out there in the morning, walking to that car, asking those questions, checking the temperature, and having that child come out or telling the parent no to move forward? So we shared this with principals today. Our plan is to create a Google Drive, and principals will go in and fill out every one of these things. This is going to be extremely helpful because it allows principals to think through that process. Hey, on January 6th, it's a lot more than just kids walking through the door. I've got to have all of these safety measures in place, and I think Mr. DeFreeze said it perfectly earlier. What are we going to do to mitigate the spread? It's going to be difficult to stop it, but to completely eradicate it. But if we put these things in place and the entire staff knows about it, then that's going to help us. Secondly, as we met with principals today, I thought about it. This could be a great PR plan that principal shares with parents. Hey, I come to you, hey, I don't feel safe having my child back on campus. What's your bus rider procedures going to look like? The principal already has it thought through, okay? And we share with the principals, this is not something that they're going to sit down and do in a couple of hours. It's just impossible. So again, this is something we've shared with them, and at the very bottom, there are things that the district office, of course, will have to supply the principals. What does child nutrition look like? Ms. Charlene will definitely fill in those gaps there, and Dr. Guzman concerning transportation. As far as the cleaning, I heard Dr. Emmanuel mention, and I'm sorry, Cole, if you'll scroll up just a second. Our plan talks about a schedule for daily, weekly, and monthly cleanings. So we have included samples there. So what does a daily cleaning look like? How many times is that custodian walking through the building doing X, Y, and Z? Are we using the foggers on Friday? So again, this is not going to be a plan that principals are going to go in and put 2 or 3 sentences. They're going to have to truly think about all of these different steps in order to bring kids back to those buildings safely.
Okay.
And I do have one other part, if you were trying, okay. This is the ugly part. Our semester will be ending in December. As I stand before you, there's been no decision to waive any accountability measures for this school. So we have to plan for administering first semester exams, end of course, and career technical education exams. So I've spent some time working with Mr. Herman, who is our CTE director. We shared this plan with high schools today, and they kind of gave us their seal of approval. But our current plan is to only test on campus. The only kids who will be on campus December 14th through the 18th, will be those kids that have an EOC or CTE. The chart here displays the maximum number of students that should be there per day. We will administer teacher-made exams the week prior. So what does that do? That frees up every person on that campus to cut down class size when we get ready to administer exams. So it's not, if I'm the biology teacher and I have 25 kids in my class, of course, that's too many kids. I may partner with the PE teacher, and that cuts that class in half. So what we've done, we've created a Google survey, and this is going to allow Dr. Guzman a kind of trial run. With your approval, we will send this out to high schools tomorrow. High school teachers in those EOCs and CTEs will begin to contact those students. Hey, your day to test is going to be first period. You're expected to be here on Monday. Do you need transportation? So when that kid says, yes, I need transportation, we're going to take all of those numbers and give them to Dr. Guzman. This again is going to allow us kind of a trial run of what do buses look like when we only have 23 kids on there. Now, again, this is difficult, especially considering we haven't had kids in the building since March. But as I've stated earlier, as I stand here, there's no accountability waiver at this point for this school year. And our high schools are still held at this point to a 95%. So we have to do everything we can. And I don't have the EOC number separate from this, but I'll take Fairmont High, for example. If all 200 of those are EOC kids, we're still expected to test 95% of those.
Amen.
Is this waiver from the state or is this feds while we're doing this?
This waiver would be a federal waiver.
But the state would have to request a waiver?
The state would have to request it, but right now there is no waiver available. The feds have shared, and I cannot, please forgive me, I can't remember, sometime late September, I think Betsy DeVos sent a memo out that pretty much in one sentence said, don't bother asking, is pretty much what she stated.
I will concur that with Mr. Bobby. I seen that also where she said, don't even ask, we're not doing any waivers for testing.
I have to say it's inhumane, it's inconsiderate, and it should have been brought up, not by us, but that should have been a big thing in the election that testing children, and they didn't have, some of them didn't even have the contact, some of them didn't have the internet. So I have to say in defense of children, it's just a terrible decision, and it has nothing to do with anybody in this room. It's beyond our control.
And I can tell you that we had a webinar last week with accountability, and Dr. Segal, one of the first things he said is things could change after next Tuesday. Now, there was absolutely no direction about which way that change could take place. But I think that's the general consensus of most of us who are in the accountability world, is that depends on what happens tomorrow night and maybe a month or so after that could determine really what happens with accountability for this school year. And that's not going in any direction or the other, because I don't think anybody truly knows at this point. But considering, again, I've said it for the last 14 or 15 years, as I stand here today, because as we know, it could change tomorrow. As we stand here today, we have to plan for those kids to test on December 14th.
You have to do what you have to do.
Ms. Terry?
I know that much of the conversation this school year has been about safety and COVID, and, it seems like our board meetings and entire school year has been dominated by this conversation. But at some point, I really think that, and I appreciate you bringing this up, Mr. Bobby, at some point, I really think we've got to get start a serious conversation about where we want to go as a district strategically in terms of, our curriculum and making sure our students are on the right path and, strategic planning and that sort of thing. I really think that even, because we don't know how long we're going to have to deal with this. Let's all not forget, our kids are in school now. They're in school right now. So let's really kind of step back, away from the, just always, every now and again, step away from the COVID and the safety situation. I know that's on the forefront, but just let's keep it in our minds that we're responsible for what's going on in these classrooms right now.
Dr. Manning?
I just want to respond to Mr. Terry, and I think everybody feels as he does, but to state that the state guides the curriculum. We have absolutely nothing to do with the curriculum now, and if they have standards that we have to meet. So even with this online, our teachers are teaching to those standards. So I have to give them credit. They are doing everything they can to meet the standards. You see, they can't even plan a lesson unless they use those standards. There's a standard for every course, and there is a standard they have. It's all regulated by the state, what we're supposed to be teaching, the standards, the goals. So I don't think that our teachers have ever gotten slack about what they're supposed to teach, because that's mandated by the state.
Mr. Lowry.
Yes, sir.
So pretty much we're having, in other words, the testing is going to be going on December the 14th. Is that correct, Mr. Bobby?
Yes, sir.
Okay, and so this is mandated by the state. Am I correct?
Our testing window is general statute. Yes, sir. So general statute states that for any course that requires a EOC or CTE, it must be done in the final 5 days of the semester. Yes, sir.
Okay.
That's
So
state.
how can we justify giving these kids a test? They haven't been in the classroom or anything. And does anybody or has anybody seen any of the progress reports at any of the schools across the county?
Yeah. What course went up?
Yes, sir. Report cards have gone out, and I'm getting head shakes. So yes.
Okay. So in other words, these assessment tests are going to be given by the 14th, and whatever happens, it is what it is. Am I correct?
You're correct.
Yes.
Well, I think that's pretty shoddy right there by whoever come up with that right there. Because if you can't go a year and you haven't had, and I'm not just talking about our county, but the state and the whole country, and to throw a test down in front of a kid by everything that's going on right here and the pressures being put on these teachers, being put on these kids right there. I don't know who come up with this plan, but that's pretty stupid on their part. I mean, that doesn't even make sense to assess a child with everything that we've had going on right now across our county, knowing that they're already in disarray, just like teachers are, and there's so much stress put on everybody at this time, and then you're going to give them an assessment test. I think that's, well, I'll leave it there. But whoever come up with that, Mr. Bobby, make sure you tell them that they're stupid.
Mr. Terry?
Dr. Emmanuel, I understand, the standard course of study and that sort of thing, but I'm actually referring to what we're doing locally. For example, what are our key performance indicators on using our interventions? We have various interventions, throughout the county, such as like tutoring and that sort of thing. How do we know that, what are our local performance indicators to ensure that all of these interventions that we're doing here locally are working? And, what's our short-term, 1 year, 3 year, 5 year plan to close the achievement gaps here? And how are we evaluating those, other than by what's being done at the state level? That's what I'm talking about when I say, our strategic plan in terms of curriculum.
Let me see if I can, may I?
Go ahead.
Let me see if I can help answer some of it. if you will go into school improvement plans and they have indicators, you may want to help me here with the indicators, and they have certain indicators that they have to meet. And used to, now I don't know what they do now, you had to put those indicators and where you wanted to go, what percent you wanted to meet with those indicators. And Title I has those indicators. What do they call them?
They're NC Star indicators.
ANSI stars, yeah. They've got all those indicators. So you probably, Mr. Turr, would want to have a good conversation with Mr. Robert and Miss Jennifer and be, say what you're saying again to them and let them tell you the standards, the metrics that this district has to use. But they're not, and this is not mean, they're not teaching in the blind. If you look at their school improvement plans, and the district also has a strategic plan, the state requires us to do when the state sets the goals, then the district has to set their goals when this board had to approve it. And under those goals, they have to set up the school. Then the school, they do their school improvement plans based on the district goals. In other words, it funnels down. And they may want in that, they have your different indicators. So sometimes maybe there should be a discussion. Maybe it should be a workshop with the board, those that are interested, that some of that stuff could be shared. And I understand totally what you're saying. Thank you. And I respect what you're asking.
Yes, Mr. Terry, again, with everything Dr. Emanuel's saying, there is district plans. And all of these, they might not be meeting like we normally would be meeting, but there is indicators that's there. The teachers are having to use the standard course of study. They're using pacing guides, so they're using the things that would normally be used in the classroom. Now, is it as easy as it would be if we were at school? Absolutely not. But if you've been online with anybody teaching or seen any actual teaching going on, they're following, what they're supposed to as best I'm gonna say as they can right now. And there's plans for basically everything you're talking about. Have we spent time on it? No, I'm not gonna say we have, but we get back, we can look at some more curriculum meetings just to share that just with everybody. Mr. Brewer?
I know previously, before the pandemic, the state would hold parents accountable to make sure their child participated in an education. And what measures are we taking, or plan to take, I should say, to ensure that we get as much as total participation on our virtual schooling at this point? Is that something that we have guidelines for, or how we gonna handle? Because right now, I know a lot of teachers, their heart's in teaching the kids, and their concerns are, they may have 10 today, they may have 5 tomorrow. It logs in. What's the accountability piece?
The accountability piece is that the teachers are working with the parents. If a child doesn't sign in and doesn't show up, the teachers are calling those parents. We have social workers who are going to the homes. So we have steps in place so that, and sometimes, I was told just today, that sometimes parents will block the teacher's number because they don't want them calling. That's not a big number of students. So we're reaching the majority of our parents and kids.
But they understand that it's a requirement.
Oh, yes, they do. And the grading system, participation. Are you signing in? Teachers are assigning certain points for that. And to be counted present, you have to sign in. So they are working.
Craig, if I can follow up, Mr. Brewer?
Yes, sir.
We have a policy, and I'm not sure if I stated this, I think this is number 8 today, that our high school exams count 25% of that kid's final grade. So there is some there's a lot of accountability to make sure that we have children participating here.
And
That can be a driving factor for some of those kids getting there and making sure that they take the test.
it's also in their policy about what's passing, what's a A, what's a B, what's a C, what's a D, what's failing.
Yes.
Savante?
Also, I know, Mr. Henry, that teachers and stuff are keeping logins and stuff when the child's not signing in class, when they contact the parent and the parent don't answer the phone, when they send the social worker, they keep logins and stuff to protect them, protect us, when they say, my child got a bad grade, or, why is my child, not logging in and stuff, we got documentations that say, well, I called you, I did this on this day. So, and we've been asking all teachers to do that, is that correct?
Mm-hmm. Yes, sir.
I think that's,
And one thing they've started doing, teachers have the bell ringer. Usually that's done in the very beginning of class. So they started using the bell ringer. So they have to answer the questions. But then they found out that the little boy was participating in the bell ringer. But once the bell ringer was done, he went outside and started riding his bicycle. So then the teacher, she said that she does a bell ringer middle of the class period and at the end. So they're learning some things.
Absolutely. Any other questions, Mr. Bobby? Mr. Terry, and we'll go to ever who's next.
This AB model, and we've got half students in class and half at home, and that's gonna, really change the dynamic for the students that are online. So it seems like it's gonna make their online time longer than it is now, right?
It should, yes.
Good, yes. Okay,
Excuse me, you re-ask that again, and I didn't understand your question.
say it again, Mr. Terry, louder.
So if we do the AB schedule, like where we got half the class, half the students in class and half of them online,
Right?
then that's almost like the students that are online spending a day in front of the computer. And they're not really doing that right now, I don't think. Right?
they're not spending the entire day, no, sir.
Right.
It's possible.
I was just gonna go back to the first thing, Bobby, about the presentations and the signage and all that stuff. I know we have our own printer. Are we printing in these signs in-house? Is everything being jobbed out?
It went to a vendor because we're not doing paper. We're doing, like adhesive so that it can go on the floor, go on the wall. The entrance signs should be metal. So again, it's a variety. It's not everything's gonna come out. None of this is coming out in paper. It's, like I said, it's different, either adhesive or metal, or some of the corrugated plastic.
Mr. Bobby, was there some of that you said that we were going to do here?
No.
No, it's all being,
All out to.
okay, okay. Mr. Bonte, do you have a question?
Yes, it's like a tennis, so what is when we start back to school, what is our times gonna be? Far as start, finish, our block schedule, how many times in the classroom, stuff like that?
We don't know yet.
Okay, that's.
And it's okay because that came up today.
Okay.
Because we have to look at, and we've already contacted DPI.
Okay.
Because we have to have so minutes of instruction unless they waive it.
Okay.
Because the staggering of the morning time for some schools may be different from others. Some of the principals were concerned that the smaller kids, if the buses are late, it gets dark at 5 o'clock. So we've got to work on that once we hear from the state.
Okay.
We've got it under control.
Bobby? Next. You have a question, Mr. Henry, as Mr. Bliss is coming up?
I was just wondering if we need to make that an action item and for approval to.
Not right now.
That.
I'll explain that one.
Okay.
Everything.
Good evening. Superintendent DeFreeze, Vice President, other members of the board. So first and foremost, I just want to send out a huge thank you to all of the staff within the public schools of Robeson County. And I just want to say, especially those of you who are at the school level, frustration is at every level within our district.
I think Mr. Mercer said it the best. We are overworked and understaffed. And that's from the top and down, from the bottom all the way up. We all feel the pain, and we definitely wish we had more staff. I'll start with, we are sending another survey out, and we want this done at the school level because at this point, we need to know by school how many teachers, teacher assistants, et cetera, are willing to come back when students return face-to-face. And once we get that number, along with the survey that's going to tell us how many children are going to be face-to-face versus virtual, we're going to be able to put all of that together to see exactly the number of staff we need. We'll never have as much as we need, but at least we'll have a starting point and we'll know where to begin and where to start asking for other staff members. I know Mr. Freeze has some plans for asking for additional assistance, and she'll be talking about that later as we get closer. I want to mention the extended paid leave. As we know, that ends in December. So those people who are currently teleworking, those people who have childcare issues, that all will end on December 30th. And beginning in January, teachers and other staff members will have to take leave. They'll have to use their sick leave. They'll have to take personal leave. There is talk that that leave may be extended. If so, we'll have to cross that bridge when we get there. But right now, as it is stated, it does end in December. And honestly, for our children, the best thing in the world, in my opinion, is that it will not be extended. We need everyone to come back to work. We need them there for our children. Our children deserve the best, and we really just need our folks there. I wanted to touch on roles and responsibilities of staff. For the most part, we have an exceptional staff, and most people go out of their way to get the job done. There's not a perfect or even a definitive definition for our job description. None of us have a clear description of our job. Our job description is whatever it takes to serve our children. And we have to be prepared to accept those challenges and move forward and just do what we have to do to get the job done. Our children deserve it. I want to mention we're getting some pushback from some teacher assistants. We have asked them to ride the bus to help deliver food. Tonight, we have mentioned that we're going to need monitors on the bus when we have face-to-face, when we return face-to-face. We know we're going to have to rely and depend on our teacher assistants, and not just teacher assistants, but the teachers have to be in the classroom teaching. And we just really want teacher assistants and all employees to know you are appreciated. We know you're doing things that you've never been asked to do before, and we appreciate it, but we need you to be there for our children. We have also sent out a poll of our substitutes. We know when we return face-to-face, there are going to be more teachers out. And so each school has done their own survey of the substitutes that normally come to their school, so they can go ahead and get a number of people that say, yes, you can count on me. Call me anytime. That ranges, one school had one person to say, yes, I will sub at your school. And that was a K-8 school. And then some schools had maybe 10 or 12. Some had 3 or 4. So it's going to differ across the district, but at least we're getting some answers ahead of time so that that principal will know if and when my teachers are out, you know, this is who I can rely on. So we are preparing for absenteeism. Do you have any questions at this time about personnel that I may be able to address?
Terry?
So if we go to this AB model, you're saying that there's a possibility and they extend the special leave, there's a possibility that some of these teachers and TAs may request to get that extended and to work remotely.
Yes, sir.
And we'll just handle that on a case-by-case type basis.
Yes, sir. That is correct.
Mike?
But the survey you're gonna send out, Ms. Melissa, when is it going out?
We were trying to wait just a little bit closer to, maybe the middle of November to send it out because we're trying to get a more accurate number for January. We don't want to send it out too soon.
Right.
And, people change their mind before,
You
January.
put that clause in there in the survey that the extended paid leave is ending December the 30th. Would they, I just want them to be aware that that the intention is for it to end.
Right.
They can't just copped out for that reason.
That's a great point. We'll make sure that is on there.
Yeah.
John?
Ms. Melissa, say it does, that extended leave don't get approved and the teacher is already all the vacation time, the sick time, and they still don't come in. You gonna put a sub in the classroom or how would that sub work?
Right. So that is that's the really good thing about coming back face to face. At least we can provide those children with a real live person. You know, we can put subs in the classroom. It still leaves us at a disadvantage as far as the virtual, those children in that particular teacher's classroom who are still at home learning virtual, because most of our substitutes are not equipped to help us virtually. The other thing is, like, the programs we use, Canvas, you know, they're not able to access those programs, and you have to be an employee of the district. So, but that is one good advantage that once the children come back, we can hire substitutes to come in and work with the children face to face.
Sandra?
We also, by having the virtual capability, we also have the leverage to resource other schools in that grade level. Is that something we're looking at also?
That is definitely something that we have looked at in the past that we have used, so I'm sure that that is something that we would look at.
Similar to the information highway.
Exactly, yes, sir.
Terry?
Whatever we do, I just want to make sure it's equitable. I just want to make sure it's equitable, you know, across the county. You know, and I'm sitting here thinking, would I rather my child be face-to-face with a sub or online with a teacher? Or, you know, a certified teacher, you know, and those are the kind of decisions and things that we're going to have to think about. So whatever it is, it just seems like there could be situations where if this works perfectly, right, there's, you know, rotation, you know, of kids, you know, in and out. They're learning at home with a teacher this week and in class with a teacher next week. But there may be other situations where, you know, depending on what school you're at, you may not have access to that same level of instruction. So I just want it to be equitable, whatever we decide.
Any other questions? Thank you.
Thank you.
Anyone else, Mr. Freeze?
No, that's good.
Closure, and I would say we will look at the signage thing, but go ahead, whatever you were going to say.
Okay. I'm not sure if you all want us to give a recommendation on the model that we're going to use. And the reason we had this call meeting was because we can't move until we know that the board just loves our model. So in order for Dr. Guzman to do his work and to get the students back in school face to face, we have to be able to, when we send that survey out, to let the parents know which model we're going to be using.
Please.
Yes.
I noticed the counties around us are doing something similar. Have you done any kind of just a surveying to see what other counties around us are doing that are back in school? Isn't Hope back in school?
Yes, on one of these, it might be in this packet, we have a list of the schools and what kind of schedule they have.
It's in the,
It's in your packet.
Not in here.
no, it's not in.
Here.
It's not in here.
Not in there.
Hey, Robert,
Yeah, we can,
put that,
email the entire packet to him, Mr. Freeze.
okay, it's
Okay,
right
that's it.
there.
We'll email the entire.
Can't see that.
See
You
that?
can't see it, but we'll get that information to you.
I just have a statement, regardless of which option we do. I think we all agree that our kids need to be in school. However, the unpopular part about both of them is, I guess parents will be upset or that they don't have a continuous schedule that they can go by, that my kids are in school every day. You know, that, but then you got to weigh, is it, who's getting the benefit of this? Is it gonna benefit the parent more or the child? And I guess I would have to make a decision on what would benefit the child more. Because I know it's going to displeasure the parents that, because, you know, go 2 days a week, and then not go 2 days a week, that can be sort of aggravating as far as babysitting care, you know, childcare. But I do think, and my decision will be based on the child getting some contact with a teacher rather than getting no face-to-face contact. I would have to, because I have to put that, in my opinion, the needs of the child over what would inconvenience, I guess, others, as far as academics are concerned.
Other comments? Mr. John?
Have you did a study from the other counties, like Cumberland County or Scotland County, about for the testing wise? Is that gonna be across the state all the same?
The testing for, the EOCs.
Yes, ma'am.
The CE, yes, that requirement is for North Carolina.
Okay, so everybody's got to come back to school.
Come back for that test.
Yes, yes.
As a matter of fact, that's national, some of it. National is federal. It comes down from the federal level.
Let me ask this, and if not, we can, yeah, move on to something else. I know the signage stuff Mr. Bobby mentioned, that needs to be ordered, right, Mr. Bobby?
We have it ordered. It's just a matter of you guys looking at it and seeing if there's a word you want to change or something like that. So the purchase order is there. He's just giving us the proof.
Mm-hmm.
And he's just saying, yes, this is what we want to use.
Okay.
Let's go.
Okay, let me ask this question, just sitting here, we're talking. The signage, I'm kind of putting it over to the side. If you're wanting to see what other counties are looking at, if that's something that we want to look at, and that's emailed to us, then I'm saying, Mr. Freese, when we come back and I'm talking to Dr. Guzman, Mr. Mercer, everybody here, that if that is emailed to us and when we come back next Tuesday, we'd have time to look at it.
Yeah.
Time we come in here then, or it'll be put on the agenda next week as an action item, make a recommendation next week, and we go from there.
For the
If-
plan.
For the plan, as far as which one, if that's the pleasure of the board. But now I'm just saying that out loud, if you want to see that, unless you're wanting to look at something tonight, actually with the plan. And part of the only reason I was saying that, I know Mr. Dwayne's on here, we wouldn't go through all this presentation again, but hopefully everyone would be here and they could, you know, we would vote on it then and go from there. Now, if that's not the pleasure, and we have a motion tonight, or Mr. Freese wants to make a recommendation tonight, we can go with that tonight.
Just keep in mind that if we wait too long, it will be February before we can go back. Dr. Guzman has said that it would take him 4 weeks to get ready
And with,
for opening in January. Dr. Guzman?
however, with the time frame of what we're looking at right now, to include getting out a parent survey of where the kids are, because we want to give parents enough time of what those options are, as well as dealing with testing, it is pushed back to 5 to 6 weeks, best way to get that through. Because that's going to push. You're already looking at the second week in January, mid-January, best case scenario right now, if we decide today, and have those survey results due by Monday. That's 5 to 6 weeks. Anything further than that, you will be going more than likely in February at that soonest, because consolidation took us 2 months. We could have done a lot more with consolidation, but we did a really great job in 2 months to do what we need. And like I said before in my presentation, we didn't have all the constraints that we have right now. And of course, like everybody says, those constraints can be either thrown out the window in a day or two, or an hour or two, or they could become back tighter in a day or two, an hour or two. So at the best right now, based on where we're at, it's going to take 5 to 6 weeks. So if we want to look into January, definitely, we would need to do the survey tomorrow and open that and not close it for a week and give the parents some time, because they need time to make this decision. We can't just.
You want to do the bus survey starting tomorrow? You need,
That would help, but then again, as a parent, it would be difficult to know for childcare purposes of which of the two I'm gonna have to make that decision.
To do the survey, you need to know which plan.
I need to, that's.
Okay, and that's the reason I was asking, and I threw out what I did. If a decision needs to be made tonight, that's what we need to know tonight. We need to come up with something tonight.
Okay, I'm gonna share, Cumberland County, they don't have their reentry plan yet. Richmond County, pre-K through fifth, all face-to-face, 6 through 12 remote, working towards middle school reentry. Scotland County, remote learning for first semester, they haven't gone into reentry. Polk County, all students, A on Monday and Wednesday, B on Tuesday and Thursday, Friday, remote for all students. New Hanover County, pre-K through fifth, AA, BB model, 6 through 12 remote. Blaine County, all students, AA, BB, Wednesday being a cleaning day. Columbus County, pre-K through fifth, all face-to-face, 6 through 12, AA, BB, with Wednesdays being a cleaning day. Whiteville City Schools, pre-K through fifth, all face-to-face, 6 through 12, AA, BB, with Wednesday being a cleaning day. Guzman County, all students, B week, Monday through Friday, a half day on Wednesday for cleaning. Harnett County, all students, AA, BB, Wednesday being a cleaning day. Now, if you look, some of these school systems are very small. They don't have 23,000 students. This county is so huge, that's why transportation is such a major issue. It's driving the decisions for reentry. Thank you.
May I ask Mr. Freed? Mr. Freed,
Dr. Manuel, then Mr. Brewer.
I'm sorry, were you first?
No, Dr. Manuel, you are, and then Mr.
Mr. Freeze, what were the cons against that K-5 model? What did you all decide that you didn't like that, K-5 face-to-face?
Too many students
The housing and busing.
Okay.
Remember, man, that's.
and 23 buses.
Busing, more routes, more students on there on campus, as well as to deal with our human capital resources of our bus drivers, teachers, as well as TAs, but services we would be able to provide. By going pre-K through 3, this would allow us to keep the amount of services, especially with my department, still running, that we would be able to provide instead of cutting something that we've already done.
Mr. Brewer.
My question to Mr. Bobby is, what's the turnaround time on all the signage that you need?
He stated that he could have it in 7 to 10 days from the time he started.
So it's not urgent tonight. But how do you stand with that?
Well, one of the things based on our reentry plan, before kids get in the building, we have to have this signage. So we know that we're gonna have some
Installation.
high school kids are supposed to come back in December.
Dr. Guzman, let me ask you, we're looking at pre-K 3. Okay, let's say we get everything done, they're coming back January 2nd. Say 6, I'm sorry. What's the bring back like 4 or 5?
We would have to look at what those human capital resources are, as well as what we are able to do with our bus fleet. Because then in order to do that, the more students that we add, we would then have to, if the changes are not made to the amount of students that the capacity of the bus can hold, we then would exhaust at some points our amount of either drivers and or buses that we literally would turn into seats or a fast transit system.
On the survey you plan to send out, Dr. Guzman, it would be in our benefit if the parents could drive their child to school. Would that be implied anywhere in the survey? I mean, we need.
I can put that in there and it would strongly be encouraged. That's part of the reason why we gave this presentation tonight, to let parents know how many people will be on the bus. And then the other information that we presented. In some instances, actually, if you go under a Plan A, meaning you bring everybody back, you can therefore have all 72 kids on a bus. However, our situation would be drastically different anyway due to the mixed grade configuration that we have here. So some schools would look totally different than their neighboring school anyway, because through our DPI section chief, we are to follow if students are going in A and students are going in B, we still have to follow the B restriction. Does that make sense? So I still have to follow the most restrictive one to keep those students. So regardless, unless we have everybody going, I have to right now maintain 23 students on that bus.
So, clarification, so if we go with everybody returning, all these restrictions you're talking about regarding buses will go away?
To a certain degree with elementary, yes, ma'am, and then in middle school and high school, it would right now be we would still have to follow one per seat unless something drastically changes. We get into the term of semantics, and that's what happened with our section chief on Thursday. Of right now, it's 23 per, and we're still kind of in some gray areas with as we get more clearly defined.
Well, these guidelines will never be able to open school.
That's part of the issue, ma'am.
Mr. Vontae?
Yeah, so Mr. Mackey was talking about, the parents driving the kids to school now. They're still gonna have to get them picked up from school now. That may be a problem with parents working and stuff. Won't be able to pick them up. They make drop them.
Oh, yeah, I understand. I mean, all it needs to be clearly explained. Yeah, if they elect to take them, they got to take them the whole time.
Okay, I just want to make sure we put that in there and also.
Yeah.
Discussion? Which way you want to go?
Let's go.
Discussion.
A discussion to let them know if their kids stay virtual, they have to stay virtual the whole year, right? Yeah, I mean, we got to put that all out there.
That's right.
Have a recommendation of which option?
Yes, of course I do.
Yeah.
Option A. And in fact, the principals met today, and the high school principals didn't vote on it, but we had 2 principals who liked B, and all of the others chose A. So we are valuing their input, and my recommendation is to support what the principals want. Model A.
Make a motion, Mr. Chairman, that we approve Mr. Freese's recommendation.
Second.
Move it to an action item.
We need to move it to an action item.
That's right, this is information.
It's information.
I make a motion, we move it to an action item.
Second.
A motion and a second to move it. All those in favor say aye.
Aye.
Any opposed?
Aye.
Any opposed? Thank you. Okay, now do we have a motion to accept the option A?
Same motion, Mr. Chairman.
Second it.
Option A.
Motion and a second. All those in favor say aye.
Aye.
Any opposed?
Aye.
And now just say, I love it. Let me hear, I love it.
This,
We're not going anywhere until we say, I love it.
holding the board up now, Mr. Let me make sure one thing, Dr. Manning, before I get you. Now, with this year, do we need to do anything separate with that signage? I don't want signage to stop us, so we're good with that?
Says already ordered.
Okay, I know it's ordered. He said something about it, so we're good with that, okay? Dr. Emmanuel?
Signs.
Pardon?
We're doing for the size, which is why it doesn't require board approval.
Okay, thank you. Dr. Manuel.
I understand we went with A, but I'm confused. A when?
January.
Anywhere.
January
January
6th.
Somebody
I
just,
can't,
The 6th.
Ms. Dr. Guzman said the earliest could be the 15th, and we decided.
well, it's gonna take 5 to 6 weeks based on what we have to push through. So we
Missing that.
ideally, if everything comes into fruition, meaning that on Monday, we have all the surveys completed from the parents and we have that information. We verify addresses once again, for purposes of where we need to transfer to and from, which takes up to possibly anywhere from 2 to 4. Now, we have already done work on this, but it's a matter of also cross-referencing what we already have. So that time frame could be knocked down, and then it would take 4 weeks for us to go ahead to do the bus routes.
Okay, let me ask this. We've already approved to return to school before this January the 6th. That's been approved. So that would have to be changed. Now, question, and this is everybody here and Dr. Guzman. We're approved to go with option A now, okay? We want to get the survey out, so you're going to get some results. Can we come back next Tuesday? And I'm saying, seeing where you are, looking at the date then. Or do we leave it at the 6th now with the understanding that that date could have to be moved back? That's my question. We leave it there now and just look that if we have to adjust that date, we can adjust the date.
I don't want to start throwing out, because we could possibly, depending on what information we get, move quicker. If we don't get said information, then it's making sure that we do what we need to on that. Plus, to be quite honest with you, sir, with the changes, we have holidays coming. We need this negative Nancy on this, but we might see a spike in the cases, we might not, and we need to be prepared for maybe possibly even coming back and looking at a phased entry, maybe like kindergarten, or to some option like that as we go through, depending on what our metrics are. I don't have that crystal ball, but we are definitely, my staff is prepared and is going to move as fast as humanly possible to make sure we do it.
But just trying to make it clarified, and to those that's watching too, the date we have is January 6th. And we're just leaving that there. And all we did now is we've approved option A. And it would be for January the 6th, unless with all these other things coming into play, we have to adjust that date.
Correct.
That's correct. That's what Lois, Mr. Priest mentioned earlier. This is fluid.
Right.
What was the
Change.
Flexible.
Flexible.
That's what we're working on.
We're supposed to say we love it.
Sir, does he need
Hey, man.
somebody else assigned with him to help him?
The
Mr.
answer to that.
Dr. Guzman?
Yes, Dr. Emanuel, that would be great, and I will get with Mr. Priest and Erica to see. In our Tim's routing currently, we only have Mr. Dwayne Black and one other, Mr. Paul Carmichael, doing routing. It'll take some of them also to do the high school, which that's a little bit easier due to the numbers. I would love if we could, another person just to be able to help, or maybe 2 to help with the confirmation once we get those in. But however, we could possibly reassign people so that there's no extra cost for the board or anybody else to go through, Dr. Emanuel, because we kind of already talked about that today, as well as in previous weeks with my staff. The hard part is the time that's required to do, just like Ms. Renette McQueen will be handling EC. It's hard to get somebody caught up to speed once it gets into the Tim's routing system. That is not an easy system, just anybody can pick up and learn, and to be able to go through, because it takes time as well as training to be able to provide certain things. Otherwise, we're doing twice as much work.
We
So
got some sharp people now.
they're very sharp. That's why we will
We have-
have possibly people reassigned at the beginning part. So as long as the schools can assist, especially the hard part is the teachers that are gonna be in there, as well as everybody on the school, to ensure that we have the right data, meaning telephone numbers, as well as correct addresses that we are going to. That helps clean up the process to make that process go quick.
Yes, we'll send you the personnel that you need, because I've already promised the teachers, if they get the correct phone numbers and addresses for Dr. Guzman, I'm gonna have something special for them. So look out.
Okay, I'd like to thank everybody that had a part to do with this. It did, and it will take a lot of work, and we thank you for what you've, done so far. And Mr. Freese and just all the staff, we appreciate what's been put forth with this so far. This time, do we have a motion to adjourn?
I make a motion.
Second.
Motion and second. All those in favor, aye?
Aye.
Have a good evening. We're adjourned.
Almost right.